Hi, this is Christine Porter with the Times News. I'm here with Dr. Kara Coassolo, an obstetrician with Lehigh Valley Health Network. We're talking about the complications due to COVID in pregnancy.
Some women are expressing concern about maybe we don't know everything in the pregnancy, so maybe I'll wait to get my vaccine until after the baby's born. The danger with that, well, there are sort of two issues with that. One is that leaves her this time period of being unprotected, and a time period, particularly when case numbers are increasing, for her to be at risk of getting COVID and becoming sick with COVID. And then the baby may not get any, if she's not breastfeeding, the baby may not get any protection. So that small added benefit of giving some protection to the baby may be helpful as well. Some people have asked even about women not who are pregnant right now or breastfeeding right now, but who are contemplating pregnancy in the future, that could this provide some, could COVID vaccination cause an increased risk of infertility? And there's no scientific evidence that an mRNA vaccine should cause infertility in a woman. Most common vaccines that are given are the Pfizer and the Moderna. Those are mRNA vaccines. Though that does not cause any changes in a baby. It doesn't cause anything to cross the placenta except for the antibodies that the mom naturally makes after the vaccine, which is actually good. That's what we want to happen. And so we don't expect that that type of intervention could cause any harm to the pregnancy or to the baby. And what we really are focused a lot on, especially now with cases going up in the Delta variant, is does that provide protection and safety for the mom, thus keeping both the mom and the baby safe? And that is one thing that we have to consider when we're thinking about COVID in pregnancy, because although most individuals who get COVID have a mild course of disease and are not hospitalized and do not have serious complications and don't die of COVID, some people do. And pregnant women are at higher risk of having serious complications from COVID. They are more likely to get respiratory diseases like pneumonia. They're more likely to be admitted to the hospital, to need a ventilator, to be in the ICU, and unfortunately even to pass away from COVID. And so pregnant women are generally young and healthy, and that's a population that we don't worry about as much when it comes to COVID, but pregnant women are more likely to have those serious complications. So that's part of the reason why we're recommending to women who are considering getting pregnant to be vaccinated, and if they hadn't gotten vaccinated, to get vaccinated during pregnancy.
What is it about pregnancy that increases the risk for complications to COVID?
This is not unlike influenza, and we've known about this for many, many years, that pregnant women who get influenza or the seasonal flu are at higher risk of developing complications like pneumonia or needing hospitalization. Some of that probably has to do with the changes that happen in our body with pregnancy, the changes in respiration and in lung function, and the physiologic changes that happen, especially in the third trimester of pregnancy, that it just makes women less able to sustain that lung injury and still be able to provide good oxygen to tissues. Pregnancy also has an increased metabolic demand on the mom. She's not only taking care of her body, but she's supplying this growing baby with everything she or he needs to grow and develop. And so that puts more of a strain on the mom's body. So at the beginning of COVID, when we didn't know how it would affect pregnant women, we worried that because of the way it affects an influenza, that they could have more complications. And now we know from gathering the data that it does have higher risks of complications for pregnant women.
Thank you to everyone for joining us at home. And for more health tips during the COVID-19 pandemic, please visit the Lehigh Valley Health Network news blog at news.lvhn.org.